Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection Series. New series today, Aging in the 21st Century, What Caregivers Need to Know Now. We have the privilege of having two of our guest speakers who many of you know and who've always done such a special job for us in this area. Dr. Elliot Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He brings more than a decade of experience in public health to our program. He has worked in many capacities to support the needs of communities and caregivers, both as an educator and as a manager of community-based health programs in Canada and the US. Dr. Sklar is an expert in issues addressing aging and the LGBT community, and has published and presented his work internationally. Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy's also a private consultant or a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mother for about 10 years. And with that, Lucy and Elliot, we would love to hear from you.
Lucy, you're on mute.
Here we go. I guess you muted me. Good morning. Before we start, I just want to tell you that I had a very, very bad cold. And the first thing that I thought was I had COVID, but I didn't. I tested negative, but still suffering from the effects. So if I sneeze or cough, please excuse me. So again, welcome. You know, so much has happened to all of us in the past 2.5 years. For many of us, it's as if everything has turned upside down, and especially for seniors and caregivers. Prior to the pandemic, we all felt that we had many options in regards to where we would like to live or what services we needed to maintain our quality of life as we age. So in our session today, we want to focus on long-term care facilities. What happened is really important to understand. And what are the lessons learned? And did we learn the lessons? And are there any changes? So we're going to share that. Some of things have happened. And really, what you yourself need to know about all of us as we are aging. You know, a few years ago, if you've looked up the word long-term care facility on Google, you had a very different search result. As I looked for photos for our presentations today, this is what my Google search looked like. Many of the Google Images results actually address COVID. So there's a very clear association between long-term care facilities and COVID. That's a very real reason for that change. You know, there's really a very good reason. So let's talk about it. In my opinion, the greatest success story of the 20th century is aging. If you were born in the 1900s, you lived to be 40. What I really want to kind of sort of say at this particular point is, Elliot, I think I'm getting into your discussion a little bit more. I didn't really focus on that. Must be the cold. Go ahead, Elliot.
That's okay. That's okay. You know, I love to do these Google image searches because I think, you know, sometimes we think that our perspective is, you know, maybe unique to us, but sometimes it's good to take a look and see what everyone else is out there is thinking. And you see here quite clearly that the association with long-term care facilities, there's a very strong association with COVID. You see it in the masks and the isolation. And as Lucy was saying, we really do feel that one of the greatest success stories of the 20th century is aging. And that's measured by life expectancy. If you were born in 1900, as Lucy was saying, life expectancy around then was only about 40. But if you're born now, life expectancy is, you know, somewhere between 80 and 100. We've lost a couple of years over the past 2 years because of the number of people who have passed from COVID. but life expectancy has consistently been going up. Now, the reality is that we do have to ask ourselves how to take care of these people who've aged in a way that makes them require more care. And really, that's where nursing homes come into play, because as people are living longer, they have more healthcare needs. So really the question here for our participants is, how has your view of long-term care changed since the pandemic began? Evelyn, I'm going to ask if you can help to unmute and because we would love to hear from our participants. You were muted, Evelyn.
What?
You're muted again, Evelyn.
Okay. You have anybody who would like to respond to Elliot's question?
You can feel free to unmute your line and share your opinion. I'm
Press
curious.
star 6 if you're on the telephone.
I'll respond. This is Clelia Pergola from New Jersey Elder Law Center at Oberg Law Group. Thank you for putting this program together. I think professionally, we've seen a lot of people starting to take care of themselves. A lot of people come to us wanting to take care of their parents, doing their estate planning documents and obviously long-term care planning. But we've seen a shift in where people are concerned now about themselves. And so they are doing their own estate planning documents, and we're seeing people now in their 40s and 50s instead of 70s and 80s. So I think it's been a positive change for us.
Definitely. It's good to hear that. And thank you so much for your input.
Thank you for that. Yeah, it is very important that we think about as we are aging. It is important also to distinguish the residential facilities we're talking about. So maybe we'll kind of look at them a little bit closer. So nursing homes, also known as skilled nursing facilities, SNFs, include 24-hour supervision, nursing care, 3 meals a day, and assistance with activities of daily living. Nursing home residents are usually people with long-term care physical, medical, or mental conditions requiring 24-hour supervision, but can also include patients recently discharged from a hospital who need such care temporarily. Assisted living facilities, sometimes called residential care homes or personal care homes, are similar to nursing homes, but for individuals who don't require full-time medical care on site, they offer meals and assistance with activities of daily living. The main key difference of importance to most people is that the assisted living facilities are most often paid for privately, and nursing homes accept public funding from the state and federal government. This is an important issue we'll talk more about later in our series this month, because we're having like a 4-part series. So my question to you, Elliot, can you talk a bit more about these differences so people are really clear about what the expectations are?
Sure. So in the context of COVID in our discussion today, there's a difference in reporting, and that's very important. Nursing homes receive government monies, as you said, and that requires them to report certain data to the Centers for Medicaid and Medicare Services, CMS. Now, a lot of the reporting that we've had on COVID in long-term care comes from nursing homes because of that required reporting. In fact, if you've participated in one of the programs that Lucy and I have facilitated on COVID, we often give updates from the AARP long-term COVID care dashboard. And the data comes directly from CMS, from nursing homes. But we need to remember that about 1 million people live in assisted living facilities, roughly the population of nursing homes. They're roughly the same, but only nursing homes are required to report data. So there's a data gap for all settings across the care continuum, which really makes it very hard for us to fully assess the impact of the pandemic on seniors and also people with disabilities living outside of nursing homes. Now, with that said, COVID-19 deaths in long-term care facilities make up at least 23% of all COVID-19 deaths in the US, as shown in this figure by the Kaiser Family Foundation. Now, the share has decreased since the start of the pandemic, when long-term care facility deaths were nearly half of all deaths nationally. The share has dropped over time for a number of reasons, and this includes high vaccination rates among residents, rising vaccination rates among staff, also an increased emphasis on infection control procedures that were not in place before the pandemic. There has also been a declining nursing home population occupancy because people really don't want to be there. And the lack of data on deaths in assisted living and long-term care facilities, other than nursing homes in most recent months, is very important, I think. Despite this drop in the total number of deaths, nursing homes have continued to experience, unfortunately, disproportionately high case and death rates in the country during the recent Omicron surge. Higher case rates may be attributed to the highly transmissible features of Omicron and also the continued nature of congregate care settings. These settings were not designed for isolation. Higher death rates may also simply be the fact that people in nursing homes tend to be more sick and thus at higher risk for complications because of COVID. That's just a very simple association. And we know that some of the risk factors include age, first and foremost, and also having other comorbid conditions. Now, unfortunately, more than 200,000 long-term care facility residents and staff have died since COVID began. And the CDC's latest updates reporting data on nursing home deaths as of the end of January, which is our most recent data, shows that approximately 82% of nursing home staff and 87% of nursing home residents were fully vaccinated. But that doesn't include boosters, and we've seen lower rates of boosters in some parts of the country. Now, you might have heard or read in the news that recently the Florida legislature, where I live, passed a bill that will make it easier for people to see their loved ones in long-term care facilities moving forward, should there be another outbreak or not. Now, at least 8 states have already passed similar laws, and several other bills are under construction. Now, some laws, like those passed last year in New York and in Texas, are specific to long-term care facilities. They allow residents to designate essential caregivers, known also as compassionate caregivers, and these people are allowed to visit regardless of whether there is a health crisis, a quarantine, etc. Texans also added protections in their constitution. And while the visitation laws open the doors, they include provisions to protect patients and staff by directing facilities to establish infection control measures that families must follow in order to enter the premises. Now, that could mean health screenings, mask wearing. In Florida, protocols for visitors cannot be more stringent than they are for staff, which is interesting. And you do not have to ask for proof of vaccination. Now, part of me feels relief for caregivers because these laws protect their ability to visit their loved ones. But part of me also feels concern given the data that I've just shared. We were still in the 80% for being fully vaccinated, and certainly for boosters. During our last report, some states were in the 40s and 50%. So that's concerning to me. This issue has also really highlighted a lack of preparedness. And I think that how facilities adapt will depend on policies and what resources are available. There's a lot of lobbying and advocacy going on right now, which I think is important in supporting long-term care workers. And it's also important in protecting families and patients in the future as we all age. Now, I'm curious for participation, input from those who are here with us today. What are your thoughts about all this? Do you work in long-term care? Do you feel concerned about these new laws allowing visitation under any circumstance?
Unmute your phones, folks, and we'll call on you. I'd love to hear from you. You can also use our chat room.
I know,
Well,
Evelyn, this was something that you wanted us to talk about today, and we had already, planned on doing so. Well, I apologize. I didn't mean to cut you off. What were you going to say?
well, I really, if I had a loved one in a nursing home, I would want to make sure that everybody who walked through the door was vaccinated. I mean, I think it's great both for the caregiver and the resident to be able to have access to each other. And I, for one, don't understand the resistance to vaccination. We've been getting them all our lives. I don't understand it, and I really feel like people need to be vaccinated to go into a nursing home because these people are so vulnerable.
Well, it's really no different than vaccine programs in our schools. And early on in my career, that was one of my first jobs after getting my doctorate, was as a school health-based program administrator. And that was during H1N1. So similarly, then we had a brand new vaccine. It was that nasal spray, and there was a high level of vaccine hesitancy among parents. They were concerned about the effects on their children, but it became mandated in all schools. There was no opt-out. So I hear what you're saying, Evelyn, and this is what is again unique about the difference between assisted living facilities and nursing homes. Many assisted living facilities have made it a policy that all staff and visitors have to be vaccinated. And they're able to do that because they're independent and private.
Good to hear.
Anyone? Any comments?
Just press *6 on your phone, folks, or unmute yourself on your Zoom.
I would like to say I agree with Evelyn's comment that I feel everyone coming into the facility, either nursing home or assisted or office or wherever, should be vaccinated. At the same time, I'm feeling that safety is not the most paramount issue. And as we found that the social isolation caused a lot of death and decline also. So I think we need to put some more thought around that, having worked in long-term care where safety came first. If you start questioning that paradigm, you may be on a very slippery slope.
Yes, you're absolutely right. And we're talking today about what lessons learned. What did we learn? And it's just mind-boggling because I'm from Canada, and it's taking an awful lot of time to kind of identify everything and to put changes in. So I totally agree with you. And I'm hoping for the future. And as we go through our session today, there has been some wonderful things that are happening, and I'm glad to report that. So the whole idea behind this, it's a balancing act for sure. Is there anyone else who would like to comment before we move forward? Okay, so as we're talking about, a lot of people lately find themselves wondering about the safety of nursing home environments, even people who work there. There's been hesitation on the part of people about going into nursing homes, even post-operative, and many healthcare workers are looking for new lines of work or working environments. There are issues that the pandemic brought to light alongside the fact that our population is aging and people are living longer, which requires more care. So I think one of the lessons that we're learning is that, we're losing a lot of people in the healthcare. As an example, certified nursing assistants, CNAs, make up the largest group of employees working in the healthcare facilities, providing more than 90% of the direct patient care. Most make just about $13 per hour, and many don't receive sick leave or benefits. I hope we're learning that lesson, you know. Many work at multiple facilities to make ends meet. In doing so, some were accused for unknowingly spreading COVID-19 to residents, even as other frontline workers were seen as heroes, and they were. CNAs in nursing home had one of the deadliest jobs of 2020. Okay, so what lessons did we learn that? I mean, you put people in a position to make salaries that are so low that they have to have more than one job just to make ends meet. And it, you know, the virus did spread. So demand for nursing home staff is really very high. The US Bureau of Labor Statistics project job growth for certified nursing assistants positions will be twice the average rate of that for other occupations over the next decade, mostly driven by an aging population with complex health needs. Demands for registered nurses is also expected to be high, yet the supply of workers is limited. So what are we going to do about it? A recent study found that on average, a nursing home's entire nursing staff could turn over at least once in a year, and some more than 3 times in 1 year. Can you imagine what that does to the population and to the work? In most recent national job reports, nursing and residential care facilities as a group continue to see a downward trend to employment compared with other sectors of the healthcare. So there are reasons for the high turnover in nursing homes and low supply of nursing home workers. It has been well documented that nursing assistants, for example, as I said, have low wages, averaging around the highest around 15, but more around 13 per hour in nursing homes, few benefits, job dissatisfaction, and a lack of career mobility. So the pandemic has made it even more difficult for nursing homes to recruit, given concerns over insufficient personal protective equipment and high rates of COVID-19 infections and death among the staff. So, I mean, the same thing goes here in Canada. There's a shortage of nurses, and we call them a little bit differently, home help. And it is concerning. So I'm really hoping that the lesson learned from these facilities is to look at that and how are they going to fill that gap. So I was wondering if we have any healthcare workers, I think we do, participating. What are your thoughts about what we're telling you? And is your organization looking at those situations? I'd love to hear from you.
Yeah, folks, please, please, please join us. Unmute your phone. Let us know what you're thinking. You know, the one thing, Lucy, that you didn't mention is how incredibly difficult the work is for CNAs. They're lifting, they're emptying bedpans, you know, there's always a bell ringing, you know, there's never enough time to do everything. You know, the family comes in and makes a complaint, and they're just doing their best because they're short-staffed. So it's a very difficult job.
Very difficult. And they've also bared the brunt of a lot of family caregivers upsets with the ongoing staffing shortages in long-term care that we've been talking about for a long time, since the pandemic began and prior to that.
Absolutely. So are there any healthcare workers out there who would like to make a comment on what we've been talking about?
We'd sure like to hear from you.
Okay. You're on, Elliot.
All right. Well, you know, I think this is something so important that we need to be thinking about and talking about. You know, we need to make sure that we're protecting the people who are caring for our loved ones, both in terms of providing fair wages, but also making sure, I think, that they're vaccinated. And, you know, as you said, Evelyn, if I had a loved one in long-term care and I was a caregiver, I would feel much more comfortable knowing that everyone in the facility was vaccinated and had to be. And I think one of the lessons that we have learned really is that nursing facilities and nursing homes were not equipped to serve as quarantine facilities. Now here I have a communal dining room image and a buffet here because these were the hallmarks of these facilities. community social rooms, activity rooms, dining rooms, and kitchens. They fail to provide the kind of social distancing that we have been advised to heed during the pandemic. Now, some levels of care, Evelyn, as you mentioned, like bathing and feeding, these things cannot involve distance either. So there's a very high amount of personnel needed to staff these facilities, which also increases risk. And the reality for many staff is that salaries, as we said, are not sufficient to cover living expenses and student loan debts. So our healthcare system, like others around the world, and especially in countries with large amounts of seniors, we're simply not prepared. Now we need to learn from this. And I think about the fact that we need new infrastructure for aging and more money to be invested in healthcare and healthcare education. We talk a lot about how expensive healthcare is in the US, but we never start the discussion at the beginning. And because I'm a healthcare educator and I teach nurses and PAs and CNAs, to me, that's where we begin. Tuition is simply too expensive. And so that then becomes a concern for people. So as more people are living longer, people might need to have the option of long-term care. And I think it's something that we all need to think about and think about where our tax dollars are going. It's a very, very important issue because everyone participating today has a longer life expectancy than the generation before them. And we just don't have an infrastructure to support that.
Elliot, we had a comment from Becca, who is a former CNA, and she wanted to talk a little bit about, the reputation of CNAs. Becca, are you with us?
Hi. Forgive me, I'm having a snack before my next client.
Enjoy.
Thanks. Yeah, so I basically just said that I kind of worry about giving CNAs a bad rep, but I worked as a life enrichment coordinator for 6 years and a volunteer coordinator in a couple different nursing homes. And you'd see it all the time where you'd have really great CNAs just doing the most, and they'd be picking up the slack of others. And you tend to lose good staff that way. They get burnt out quick.
Absolutely. We can't applaud the work of CNAs enough. And that's why we bring this to light, because we feel CNAs need to be paid more and have better balance, certainly between the cumbersome work that they do and having balance in their lives. Their positions should afford them the ability not to have to work multiple jobs and get burnt out.
Exactly.
Right. The hamburger people flipping hamburgers make more than the CNAs do.
Yeah, it's pretty backwards.
Yes, it is. And thank you for your input and your insight.
Thanks for being here to educate us.
It's our honor.
And you're educating us as well, that's for
That's
sure.
right.
Okay.
Anybody else? Can unmute your phone or unmute yourself on Zoom. As you can tell from the comments we've had so far, these things really are enriching to all of us, to hear your experience. So it's really important. Really, we really want you to share and not be, you don't have to be online. You don't have to have your picture up. You don't have to give us your name if you're on the phone. You can just go ahead and talk.
I mean, I didn't even put makeup on before a meeting.
I kind of noticed that, Elliot, but your hair looks really good.
Thank you.
Yes. Well, talking about staff shortages, in the most recent AARP long-term care dashboard published only a few weeks ago in March, we got some good news. So I want to share that with you. The percentage of nursing homes that reported a shortage of nurses or aides dropped from 39% to 36% during the most recent 4 weeks of reporting. The percentage of nursing home reported a shortage of nurses or aides, but have been holding steady at about 30% for 4 months. With the Omicron surge in COVID cases, the percentage of nursing homes reported a staffing shortage in January jumped to a pandemic high of 39%, which was extremely concerning. Even 36% is alarming, but the number is going down and we hope it continues to. In the meantime, keep these staffing shortages in mind and keep in communication with your loved ones. I'm really talking directly to caregivers and anyone working there also. Do whatever you can to make sure that they are receiving adequate care and that they are occupied and entertained. So even though things are opening up and some of you might be reluctant to go in, and that's okay. Everyone has to make their own decision, but you have to keep in touch by knowing, by getting to know the staff on the wards, by sending parcels, any way that you can, whether FaceTime, acknowledging and thanking the staff for the work that they're doing. They need to be told that. It's so, so important. But if you do go, watch for the signs of possible neglect or abuse, you know. Even if you're caring for someone with cognitive impairment, their body language will tell you a lot of really how they're really coping. Look for bed sores, look for any signs that of neglect. And again, it's important to report. Elliot's going to talk a little bit more about all these things, but at the same time, to go there with open eyes and realize that the staff is really having a hard time. And where could you fill in and how could you ask other family members to share in that? So we're going through a very, very delicate transitional period at this time.
Absolutely. You know, and we have some information here on the screen about booster rates that I talked about before. I would be remiss as a public health professional if I didn't offer up the opportunity if anyone has any questions or wants to discuss the recently approved 4th booster, because I think that this is also something important for people, especially in long-term care, now that the FDA has approved a 4th booster for people 50 and older. Any questions, comments, discussions? Evelyn, sorry.
Just unmute your phone, folks, or unmute your Zoom. This is, I think, a huge question right now as all of these changes are taking place. And I don't know about other states, but I know in our state, the uptake on getting a second booster is at like 40%. I mean, it's terrible.
The uptake is not great on getting a 4th booster, but if it's okay for me to share, Lucy and I had a conversation about this ahead of our program today. You know, my opinion on boosters right now, this 4th booster, the FDA approved this in the event that we would have another Omicron-like surge. We haven't been seeing that in local communities. There is the Omicron subvariant, but we have not seen community spread like we did at the end of November and December and in January. So my suggestion is before people rush to get that 4th booster, take a look at what your community transmission rates are, because we know that the efficacy of these boosters tapers off pretty quickly after just a couple of months. It's kind of, you can think of it akin to a flu shot. So we know that we get inoculated for the flu during flu season, not the off season. And that's for a reason, because the effectiveness of the vaccine wanes over time. So I would personally hold off just yet on that 4th booster until we do see some higher levels of community transmission, which I hope we don't. But that is the intent of the booster. So it's important that people speak with their doctors. And if you have loved ones in long-term care, please speak with the physicians that your loved ones are patients of, because it's important. For example, in long-term care facilities, it might be more important to get that 4th booster because you're in an environment of potentially higher transmission or spread. So does anyone have any questions about that before we continue?
Please go ahead, folks. We'd love to hear from you. Unmute your phone by pressing *6 or unmute your Zoom.
It's a bit of a controversial topic because COVID has now become everyone's decision as to how they want to handle things for themselves. And so it makes it difficult to know and to trust what guidance is out there.
I think when we spoke about it, Elliot, you made it really very clear, and I thought that your recommendation was right on. I think it's important for just to see what's happening in your community and not just rush into it.
Well, we saw last spring and summer that transmission rates went down. And that was in part because of vaccines and vaccine adoption, but also because more people were outside. And, just like we see with cold season, that tends to be worse in the winter months. So I would say wait and see, and also consider the risks in your own environment. Like I said, if you work in a long-term care facility, that's a high population environment, so you may consider getting the booster. Now, we do receive questions from time to time, and we received this one that this caregiver is concerned that since the pandemic began, her mother, who lives in a nursing home, is not receiving the same level of care as before the pandemic. There seem to be ongoing staffing shortages to a point, and this is from the question, that I feel is neglectful. And I'm curious what the rights of nursing home residents are. That's a very important question, and everyone should know this. The Centers for Medicare and Medicaid Services has a list of residents' rights and protections under federal and state law. Broadly speaking, these include the right to be treated with dignity and respect, be free from abuse, neglect, and discrimination, have friends and family visit and participate in your care, take part in activities. You can make complaints without fear of punishment or retaliation. And this is key, obviously, receive proper medical care. Now, everyone also has the right to have a doctor, family member, or legal representative notified of changes in condition or treatment. Now, we always recommend trying to keep open communication with the staff at a facility, as Lucy said. But if there are concerns, it's really important that you document them. As we know, having evidence and a paper trail of things is important. So even if you have a phone conversation, send a thank you note with a brief recap of what you understood so that it is documented. And if you're feeling concerned about the safety and well-being of a loved one in a nursing home or other senior living facility, contact your local ombudsman. The Ombudsman program advocates for residents and can help to resolve concerns. And each facility should have the state ombudsman information posted in a highly visible location. And we have a resource that we'll share in today's resources that we always email out following our program. The National Care Planning Council has a directory for each state with contact information for each ombudsman that will be circulating, along with other excellent resources.
You know, this is such an important issue. It's so important to not let things go. You can also reach out to your local area agency on aging for additional resources and support. A major concern right now are the staffing, so that's what we're talking about, and the implications of that. In addition, the pandemic has caused a lot of burnout among healthcare workers and those working in long-term care who lost patients and perhaps other loved ones. In addition, when 30 to 40% of the workforce from a facility is gone, it puts a tremendous strain on the staff that is left behind, and we talked about that. Frontline worker are also the front line of people's complaints and concerns about how their loved one are being treated or not treated. It's a very hard place to be in right now. So even if you have a complaint, there's always a way of saying things. Try not to put people on the defensive, come with real issues, and maybe even some real solutions so that you can work together on that. Elliot and I have been talking about, we've been doing sessions on the pandemic, and we've both agreed, and so has Evelyn, that we have two pandemics going on right now. There's the pandemic and there's mental health issues. It's huge. Has anyone heard of Dr. Lorna Breen? I want to tell you about her. Lorna was an emergency medical physician in a New York's Columbia University, Michigan Center. She worked the front line at the early peaks of the pandemic and who contracted COVID-19 herself. While recovering from COVID-19 and struggling both mentally and physically, she chose to work 12-hour shifts to help save others. Her family says she would stay well past the end of her shift and become so overworked. She feared losing her medical license and receiving criticism from colleagues if she let it be known that she was suffering from workload. She died by suicide in 2020. How sad. In her honor, though, President Joe Biden signed the Dr. Lorna Brin Healthcare Provider Protection Act. The new law, which is the first to provide such funding, is aimed towards supporting mental health education and awareness campaign for healthcare workers. The law will provide up to $135 million over 3 years to improve medical workers' mental health. There is limited formal research about the burned out experience by healthcare workers during the pandemic. About 2/3 of US physicians said that burnout had intensified during the pandemic. Women physicians reported a higher burnout rate of 70% compared to 61% of men. We can draw upon this as it relates to, to nursing care facilities and staffing shortages, and have the experience in addition to high death toll experienced early in the pandemic. You know, if you're a healthcare professional, we often forego mental health treatment due to the significant stigma that is attached in both our society and the medical community, as well as due to the fear of professional repercussions. So we're put in a very difficult situation, even though we know that it's important. There are all these fears. As we move forward in this environment, we need to be sensitive to the experience of one another, especially in healthcare and in caregiving capacities at home or at a nursing home. Providing care to others during COVID-19 pandemic, which is not over yet, ladies and gentlemen, can lead to stress, anxiety, fear, and strong emotions. And each one of us, including myself, have recognized those signs. I want to really go over them a little bit with you. I know we've talked about them many times, so it's important to recognize the symptoms of stress you may be experiencing. Feeling irritation, anger, or denial. I'm not just talking about one day, but like it's really there. Feeling uncertain, nervous, or anxious all the time. Feeling helpless or powerless, lacking motivation, feeling tired, overwhelmed, or burned out. Feeling sad or depressed, having trouble sleeping, having trouble concentrating. Excuse me. Experiencing or witnessing life-threatening or traumatic events impacts everyone differently. In some circumstances, the stress can be managed successfully to reduce associated negative health and behavioral overcomes. In other cases, some people may experience clinically significant stress or impairments such as acute stress disorder, post-traumatic stress disorder, PTSD. And a lot of healthcare workers are going through this. Compassionate fatigue and burnout may also result from chronic workplace stress and exposure to dramatic events during COVID-19 pandemic. So all of you there, whether you're a professional healthcare worker or any kind of healthcare worker, whether you're a caregiver, let's look at the tips to enhance our resilience. Maybe some of you have heard this, but I think it's really worth repeating and kind of really looking at that. The most important thing is communicate with yourself first and foremost. Acknowledge your feelings. Communicate with your coworkers, supervisor, employee about job stress. It's okay. Talk openly about how the pandemic is affecting your work. It's okay to say so, because not only are you protecting yourself, but you're protecting the people that you're caring for. Identify factors that cause stress and work together to identify solutions. Ask about how to access mental health resources in your workplace. Don't be shy and don't be afraid to do so. Remind yourself that everyone is in an unusual situation with limited resources. Identify and accept those things which you do not have control over. That's a big one for me as well. I've got to, I'm working on that all the time. Recognize that you are performing a crucial role in fighting this pandemic and that you are doing the best that you can with the resources available. Increase your sense of control by keeping a consistent daily routine when possible, ideally one that is similar to your schedule before the pandemic. Try to get adequate sleep, so important. Make time to eat healthy meals. Take breaks during your shift to rest, stretch, or check in with supportive colleagues, coworkers, friends, and family. When away from work, get exercise when you can. Evelyn and I were talking about it. If there are stairs, I take the stairs and try to avoid the elevator. Dance around your living room as I do every day. You don't have to go to a gym. Spend time outdoors, being physically active or relaxing. Do things you enjoy during non-work hours. I tell myself every day, do something nice for yourself, Lucy. And I really try to do that. Take breaks from watching, reading, or listening to news stories, including what's going on all over the world. It's very, very upsetting. It's not just about COVID, including social media. Hearing about the pandemic repeatedly can be very upsetting. If you feel you may be misusing alcohol or other drugs, including prescription or over the counter, ask for help. You think just because it's over the counter, it could be pain pills, sleeping pills, it can be a problem. Engage in mindfulness techniques such as breathing exercises and meditation. If you're being treated for mental health condition, continue with your treatment and talk to your provider if you're experiencing new or worsening symptoms. Know where to go if you need help. If you feel overwhelmed with emotion like sadness, depression, anxiety, or suicidal, please acknowledge your feeling. You're going to get this number anyways with the resources, but if you want to jot this down, it's a distress helpline. You can call or text at 1-800-985-5990, and you will receive that. So as I'm losing my voice, as I told you in the beginning,
You've done a great job.
and I'm doing the best that I can. I am curious how people in our audience are feeling right now in terms of their mental health and coping. This is a safe place to talk. I can tell you that I've had my ups and downs. I've had good days, I've had bad days. And what has helped me is that I was able to acknowledge it and I was able to talk to people that would listen and not be judgmental. But it's very, very important as your physical well-being. Maybe your mental health well-being is even more so because it can really get away from you. So I'm opening it up, guys. Let me hear. How are you coping today?
Elliot, can you tell people how to get a copy of your rights as a nursing home resident?
We'll be sending out a copy of our slides after our program today. There is a link included in there which takes you to all the information that I shared about the Ombudsman program, and it also includes information about what everyone's specific rights are.
Great. And also most of the Ombudsman programs are run through your local area agency on aging. So if you happen to know the number there, you can always call and get contact immediately. And we always give the elder care locator number where you can find your area agency on aging too. And Elliot, if you don't mind, I just want to take 1 minute and talk about nursing homes. There's a stigma on mental health. There's a stigma on nursing homes. I worked in nursing homes over a span of 10 years. Everybody I ever told that I did nursing home work said, oh, what an awful job. Like, are you kidding? It's great. I walk in there and there's 10 people sitting in the foyer in wheelchairs. And this was a while back, when it was okay to sit together. And they'd all go like, she's here. And none of them knew who I was. It was just somebody, who went from chair to chair and said hello and talked to them. I mean, there's this stigma that nursing homes are bad. And not all nursing homes are bad. And as individuals, especially if we're a caregiver of someone in a nursing home, We can make them better by supporting the staff, doing nice things for the staff, understanding the pressures on the staff, as well as our loved ones.
Very well said, Ellen. Thank you.
So I'd just like to go back again. I know I was touching on a very sort of delicate subject of mental health and having anxiety. If no one feels that they're ready to talk about it, but just be honest to yourself. If you are experiencing anything that you feel is out of the normal for you, please, I don't hesitate to go and get the help that you need. It is so, so important. We're all going through it. I think Elliot could attest to that as well, that it's just not an easy time for any of us.
Well, when you go through a crisis, as we have like the pandemic, I liken it to being on an elliptical or a treadmill. You know, you're just trying to keep up. And when things start to go back to some semblance of normal, they're not, because you have to catch your breath first when you get off of the elliptical or the treadmill. And I feel like that's a good analogy for where many people are at in terms of their mental health. We need to catch our breath from the experience that we have gone through. Now, I'm being mindful of our time, so I will continue on quickly, because really the focus of this series is on what caregivers need to know now to help them age and to provide care in this environment in which we're living. During our session next week, we're going to discuss the setup of people's individual homes to accommodate caring for a loved one or for yourself if you're thinking of aging in place, which is what a lot of people are looking to do, because our view of long-term care has really changed and many people are looking to avoid long-term care settings if possible. Now, I had said before that we need a new structure, and I think that many people have the overall impression that no group living facility is ideal during a pandemic. I can't disagree with that. For years, experts have called upon a rethinking of the nursing home model, replacing large big box facilities containing hundreds of beds with smaller facilities and fewer residents. Sometimes this is called a greenhouse or a family-style nursing home. Over 60% of the nursing homes in our country were built about 50 years ago. They're aging structures, just like we are. They have double rooms, shared bathrooms, a nightmare for infection control, really. Also long corridors and nursing stations that are remote from where residents are. By comparison, a greenhouse or family-style nursing home is a model that I think is very exciting. They have small locations of care with only about 10 to 12 residents. It's personalized. It would look more like your living room than an institution. And they have universal care workers who not only help you with activities of daily living, but also maybe make sure that you call your daughter on that day. It's the deinstitutionalization and personalization of care. And these facilities fared so much better during the pandemic because of the lower number of residents, and also because of private rooms, bathrooms, and more accessible outdoor spaces. Think of it, if you're in a nursing home on the 12th floor, not so easy for you to get outside. So all of these reasons were cited as having lower cases of COVID, but this also holds true for things like the flu every season. So one factor that I think is also important is that in these facilities, the staff spend more minutes of care with their patients. This means more staff, and something we've been talking about. And the staff have a better handle, the facilities have a better handle on staffing because they're smaller. So I think we're going to see a big trend in having more of these family-style nursing homes opening up. And as some of our participants today are thinking about long-term care for a loved one, this might be a good option for you to consider in your community.
Thank you for that. So we're coming to the end of our session. So let's very briefly. So what are the lessons that we learned? You know, for me, that life as we knew it has changed, you know, and we have to look at it differently. But I think that a lot of people are resilient, you know, and we have to find the ways of coping with all that. I've worked in home care a lot before I went into doing my own private business. The government, I believe that the government needs to strengthen home care-based care. In home care visits are often more affordable than nursing home for those whose family or friends can care for them in the home or the community. President Biden has discussed aims to significantly improve pay and benefit for home health and home care aides through Medicare and Medicaid expansion. So I think that's moving in that right direction, hopefully. As one way. Another way is to improve staffing. The federal government could increase reimbursement through Medicaid, the primary government payer of nursing home, to the level of Medicare, which reimburses at a higher rate. That would put nursing homes in a better position to pay their staff more and invest in better care. Finally, if increasing pay led to a larger supply of workers, nursing homes would have more flexibility to explore novel models of care. Those models include indicators, more staff for fewer residents, as Elliot was saying. So I think the lesson learned in a more general way is what the government and what facilities can do. But on an individual level, we have to look at how did we cope with that? And again, take better care of yourself. As one of the workers was saying, that a lot of people, even in their 40s, are saying now, how should I take better care of myself health-wise as I age? And I think that that is extremely important.
Absolutely. It certainly has been the biggest takeaway for me. You discussed a lot of good future policy level initiatives that I hope come to fruition. But in the interim, I think the takeaway is that we're better off if we're in better health, certainly where COVID is concerned and all around. So I think we should each take the opportunity to focus on our own personal health. And next week, we're going to be discussing, as I said, those home modifications and also things that you need to think about if you're considering aging in place. So if you have questions about all of the news and the things that we've talked about today, we will be hosting our session same time, same place next week, and we hope to see you. We will share also all of our slides, and we thank you so much for participating today.
And Elliot, you have 2 more sessions this month, in addition to the one next week, right? What do caregivers and seniors need to look for in long-term care facility? And when is it absolutely necessary for a caregiver to place their loved one? And those are, so important, those topics, because people, it's very confusing, it's very guilt-ridden, there's so many issues attached to it. So we look forward to that, and I want to say we have just a treasure trove of great presentations during the month of April. For those of you who do not get the monthly calendar, please call our Wilmer Charitable Foundation customer service at 866-390-6491, because then you will get the monthly calendar. You will also get the resources from today. And if you're not registered for today, just let them know that so that they can send you all of the resources for today. There you go. Thank you, Minerva. Yes. And now I think I just want to thank so much the beautiful job that Elliot and Lucy always do. The homework, the research, the knowledge that you've gained throughout the years, you bring so much to this. So thank you for that. And I want to thank all of the caregivers, because you are the backbone of long-term care. And with
Thank you so much, everyone. Stay well.
And
thank you all.
Thank you very much.
care for yourselves. Give yourself a big hug now. Take care.
Bye, everyone. Hope to see you next week.
Bye. Thank you.
Bye-bye.